Hello everyone. Today's video will discuss Clostridium botulinum, including its pathogenesis, cultural characteristics, clinical features, microscopic examination, prevention, and treatment. Clostridium botulinum is a gram-positive, non-capsulated bacillus. It is motile and has subterminal, oval, bulging spores. The pathogenesis of botulism in foodborne botulism involves the consumption of preformed toxins from Clostridium botulinum. This occurs when food is contaminated with small amounts of toxins and then consumed, resulting in disease caused by toxin A, which is the most common cause of foodborne outbreaks. These toxins are absorbed from the stomach and small intestine as they are not denatured by digestive enzymes. Infant botulism typically affects infants who are under 6 months old. It is caused by the ingestion of food contaminated with spores of Clostridium botulinum. Honey has been identified as a potential source of infection. The spores germinate in the intestine, releasing the toxin. Wound botulism is a very rare condition resulting from a wound infection with Clostridium botulinum. The toxin is produced and absorbed into the blood, leading to symptoms similar to foodborne botulism, except for the absence of gastrointestinal components. Food poisoning occurs when preformed toxins in food contaminated with Clostridium botulinum are consumed. The illness can range from mild to very serious, and in some cases, can result in death within 24 hours. The time from consuming the contaminated food to the onset of symptoms can be as short as 12 to 36 hours. The initial signs include vomiting, nausea, dry mouth, constipation, abdominal pain, and blurred vision with fixed dilated pupils. The disease progresses with bilateral descending weakness of the peripheral muscles, leading to flaccid paralysis. Fever is typically absent. Infant botulism, unlike food poisoning, is caused by neurotoxins produced in vivo by Clostridium botulinum, which has colonized the gastrointestinal tract of the infants. The initial symptoms are nonspecific and include constipation, lethargy, weakness, altered crying, and loss of head control. The condition may progress to flaccid paralysis and respiratory arrest. The infants excrete toxins in their feces. Infant mortality due to infant botulism is relatively very low. Wound botulism occurs when wounds are heavily contaminated with soil or water containing Clostridium botulinum spores. The incubation period is 4 to 14 days, with an average of 10 days. Wound botulism is similar to foodborne botulism, except that the incubation period is longer and no gastrointestinal symptoms are present. The affected wound may seem harmless. Cultural characteristics. Clostridium botulinum is a strict anaerobe. The bacteria grow best at an optimum temperature of 35 degrees Celsius. They can grow on various media, including blood agar, Mueller-Thinto agar, and RCM media. Clostridium botulinum produces large, irregular, semi-transparent colonies with irregular fimbriate borders on blood agar. When grown in alkaline glucose gelatin media at 20-25 degrees Celsius, they produce spores. Prevention of Clostridium botulinum. Proper canning and preservation are important for controlling food safety. It's important to note that children under 1 year old should not consume honey due to the risk of infant botulism from Clostridium botulinum spores that may be present in honey. In the event of suspected botulism from food consumption, it's recommended to administer a prophylactic dose of polyvalent antitoxin via intramuscular injection. Additionally, laboratory staff who may contact the organism or its toxin should consider active immunization. The treatment of Clostridium botulinum requires the following measures for patients with botulism. Eliminate the organism from the gastrointestinal tract using gastric lavage with metronidazole or penicillin therapy. Administering polyvalent antitoxin to neutralize unfixed toxin. Providing adequate ventilatory support to the patient.